Hello and welcome. My name is Stephanie Williams and I'm a respiratory therapist with the COPD Foundation. I'm so glad you're here today. We're going to be talking for a few minutes about the My COPD Action Plan and why it's important to use it. We think it's important for you to use it every day, but we also think it's very important for you to use it during the time of COVID-19. So if you'll bear with me for just a minute, I'm going to switch my screens around a little and share with you some tools that I have prepared for you in advance. All right, so no matter your situation, it's important for you to have a solid idea of what your baseline health looks like. So what is your normal? What is your baseline? It's a very important thing for you to know about your health. We don't want you to compare yourself with other people. We only want you to compare yourself with you. That's why it's important for you to know what your normal is. In fact, if I had 10 COPD patients in the room with me, I would have 10 different ideas of what normal looks like. So we're going to take just a couple of minutes here and show you a tool that can help you determine what your normal is, and then give you some ideas of what to do if you notice things are a little off. Okay, so looking here on the screen with me, over here on the left-hand side, you'll see the paper version of the My COPD Action Plan, but there's also a digital version of this tool, and you can find it here on the right side of your screen. This is what it looks like. It's called the COPD Pocket Consultant Guide app. And so we call it the PCG. And the PCG app is a free app, and it's available to you through the App Store or through Google Play. So if you're using the app instead of the paper version, basically what will happen is that your responses to the questions will be captured and recorded for you. And it will then mark each day on a calendar green or yellow or red according to your responses, and it'll keep track of that for you. And you'll be able to look at that over, look back to the previous weeks or previous months and get an idea of how you've been doing overall. We encourage you to use this tool in a partnership with your doctor or your physician, physician assistant, nurse practitioners. We encourage you to use this with your medical team to help you communicate well about what your normal is and how you've been doing overall. So again, you can find this app through the App Store or through Google Play. Let's go on to the next slide. Okay, so if you will look here, I filled in the top section with my name, the date, my doctor's name, Dr. Pepper, the phone numbers, and my emergency contact information here. I also filled in this section, this other little pink section right below the COPD Foundation logo, where it says My COPD Action Plan can be used daily and should be updated every 6 months. So the next update for me would be in November. So always fill in that date. That's a good little reminder for you that you need to have another conversation with your doctor about your health. Let them know if things have changed so that they can take appropriate steps to get a therapy plan for you. Okay, looking at this next section, it's the blue section here. And if you'll notice across the top of the blue section, there are 10 different activities listed here for you. And there's also a blank section over here where you can list an activity that's important to you, something that's maybe a goal for you. So I've listed here playing with grandkids. So maybe it's an important thing for you to be able to play with your grandchildren. You want to be improving so that you can do this with maybe minor limitations, or whether you can do it completely independently. Whatever your goals are, singing in the choir, taking walks around the neighborhood, whatever that is, you would put that in that column because that's your goal. Then coming over here to the left-hand side, there's a list of qualifiers here that you can use to determine how well you're able to perform these tasks at various levels of independence. So you can see here again that I filled this out as a COPD patient, and you can see that I filled this out that I am able to do most of these tasks with varying degrees of independence. But if I were to notice a change in the way I feel when I'm performing these tasks, that's something that really needs to be front of mind, as that could be a warning sign that maybe I have an exacerbation looming. All right, let's move along here. I'm going to go to the next slide. let's take a quick note of the two separate columns in each of these different colored sections here. So in the green section, I have a column that says a normal day for me, and then I have a take action section. In the yellow section, I have a bad day for me and some signs and symptoms of a bad day, and then a take action section. And then down at the bottom, I have my red days, where if I notice something in the red, signs and symptoms, and then take action section for that as well. This is where you really need to sit with your doctor and determine a plan. Okay, so he or she would say, if you're having a bad day, then I want you to do this. If you're having a red day, I want you to do this. So we'll go through this here a little bit more in depth. So looking at the area shaded green, you're going to see a list of these characteristics here under that normal day for me. This is really important. The whole action plan hinges on you understanding this section right here and really having a good grasp of your normal. So looking here, it says my breathing is normal, my cough and mucus are normal, my sleeping is normal, my eating and appetite are normal, my activity level is normal. That word just keeps coming up over and over, right? But this is something that we kind of take for granted, that people understand what normal is. But I really want you to sit and think about that first statement. For example, my breathing is normal. Well, what does that mean for you? What does it really mean for you? Not what you've been told, but what does it mean for you? So do you normally wheeze a little bit? Do you find that your breathing is a little rougher in the morning and that it gets a little bit better as the day goes on? Explore that topic and really think about what it means for you so that you know when it's different. Again, moving down to the next one, my cough and mucus are normal. Okay, well, let's really consider that. Is your cough frequent or infrequent normally? Is it productive or not? Is it worse in the morning and gets better throughout the day? These are all things that you should be mindful of as you are determining your baseline. And it really is important that you take all of these things into account and notice these changes, because any change to these may indicate that you're in a yellow day. And your doctor may want you to call them if you're in the yellow section 2 days in a row or 3 days in a row. That's, again, that's for you guys to work out between yourselves. But understanding when you move from that green into the yellow, that there are different actions that need to be taken. So let's go to the next slide here. And you can see that I have filled out this form as if this were a day that I woke up and I found that maybe things are a little bit off for me. So if you'll look in that yellow section, I put a check in that box that says, I have been using my rescue medications a lot more without much relief. I've also indicated that I have a change in color, thickness, odor, or amount of mucus. I'm more breathless than normal, and I feel like I'm catching a cold. Well, based on what I talked to my doctor about, I know that he wants me to limit my activity, especially my outdoor activity, and he wants me to do my pursed lip breathing techniques more frequently when I'm having these symptoms. I'm going to continue to take my regular medications as they're prescribed. And if I have 2 or more days in a row, I'm going to report that to my doctor. Because at that point, if I report it to my doctor and he says, you know what, I want you to go ahead and start those antibiotics and steroids, I already have a plan. That plan is already in place. It takes all the guesswork out of it. I've already communicated with my physician what normal looks like for me, so they know if I call and say, look, I'm really struggling here, I've been using my rescue medications more frequently, they know that I know what normal looks like and what abnormal looks like for me. So it really takes the guesswork out of the communication. Again, what if I notice that I'm having symptoms and signs in that red section? What if someone notices that I'm disoriented or confused, or if my speech is slurred? This is a section where you don't want to play around. This is, if you notice any sign or symptom from this box, you want to call 911 right away. And listen, I know it is a scary time to think about going to the emergency room, but if it really is an emergency, things can get a lot worse if you don't go to the emergency room. So I want you to know that hospitals and staff all across the country have been taking measures, and they've put precautions in place to keep COVID and suspected COVID patients away from those who are not infected. So they don't want you to get a COVID-19 infection while you're in their hospital either. So They're going to do their very best to keep you from having any risk at all of picking up that infection while you're there. But again, if you are experiencing any of the symptoms in that red section, it is not a time to delay. It is a time to call 911 and get treatment in the emergency room right away. I just want you to know that this tool is available to you through our website, where we have some downloads that are available. Again, I have it posted in the comment section below. If you have any questions for us, you feel free to post them in the comment section and we'll be sure to answer them. Or you can email us at statecaptains@copdfoundation.org. And we look forward to hearing from you. And we just want you to live your very best life, being strong and healthy and breathing easy. Thank you so much for joining us today. Goodbye.